Today we will do the muscles of the tongue. Tongue has got the two type of the muscles, extrinsic and intrinsic muscles. So tongue is a movable organ, and lingual artery which is supplying it is tortuous because of the mobility of the tongue. It facilitates the movement of the tongue. When we see the thickness of the tongue, it consists of the muscles in it. They are under two categories. One is the extrinsic group and the intrinsic group. Extrinsic group are the muscles which take origin from the outside the tongue, but they are inserted inside the tongue. While the intrinsic muscles are the muscles whose origin as well as the insertion is within the tongue. That is the difference between the extrinsic and intrinsic muscles. And when we see it, the muscles this is the sagittal section of the tongue. Seen is the mandible in construction. This is superior genial tubercle, this is inferior. In the oral cavity, superiorly there is a hard palate, and hanging behind from the hard palate is the soft palate, is the uvula. And the intrinsic muscles, they are the vertical group and the horizontal group. Horizontal is also called the longitudinal. So the thickness of the tongue is because of these muscles. The vertical muscle, as the name suggests, they are vertically arranged in the anterior, middle as well as the base of the tongue. And the contraction of these muscles depresses the tongue. It makes the tongue in a downward position, while there are longitudinal muscles are present. They are horizontal muscles, and they are upper and lower group. So they are the longitudinal muscles. Then there are horizontal muscles also, which go from right to left side. They cross the midline and they bring about the narrowness of the tongue. So these are the intrinsic because they take origin insertion within the tongue. The muscles which are extrinsic, they are styloglossus, genioglossus, hyoglossus, and palatoglossus. So styloglossus, as the name suggests, is taken from the styloid process, and it is inserted on the near the base of the tongue, the styloglossus muscle, and the contraction of this muscle brings the upward movement or the backward movement of the tongue. Then from the palate also, hard palate and palatal aponeurosis, a muscle also take origin which comes downward to inserted on this posterior part of the base of the tongue on its lateral surface. So this is the palatoglossus. So this palatoglossus also forms the palatoglossal fold in front of the tonsil also. So this is the same muscle which raises it. Contraction of this muscle elevates the elevation of the tongue, which approximate with the hard palate. Then the genioglossus muscle taken from the superior genial tubercle and is inserted near the tip of the tongue, It is called the safety muscle of the tongue. Because in the collapse of the pharynx, this muscle prevents the fall of the tongue backward and prevent the blocking of the airway and the food passages to some extent. So that's why it is called the safety muscle. So the superior geniotubercle and genioglossus muscle pull the tongue in forward direction when there is a paralysis of the pharyngeal muscles. Last but not the least is the hyoglossus muscle. The hyoglossus muscle, as the name suggests, hyo means it takes origin from the hyoid bone. So it takes origin from the greater corner of the hyoid bone and to some extent the body of the hyoid bone. It is a quadrilateral muscle and inserted obliquely runs upward, and it is inserted on the side or the lateral part of the tongue. The lateral part of the tongue is the hyoglossus. Its relation is very, very important. This is the anterior border of the hyoglossus, this is the posterior border, so it is a quadrilateral muscle. Contraction of this muscle also depresses the tongue in the downward position. Now, origin of this muscle and insertion, the relations of the hyoglossus, they are very important. Relations of the hyoglossus. The posterior border of this hyoglossus muscle, it is related to three sectors. One is from the styloid process, a ligament is coming which is inserted attached to the lesser cornu by two processes. This is called the stylohyoid ligament. Then the posterior border also related to the artery which is branch of the external carotid artery. External carotid artery has got 8 branches. At the level of the tip of the greater cornu, external carotid artery gives the lingual artery a branch. And this lingual artery is tortuous because of the movability of the tongue. So this lingual artery goes deep to the hyoglossus, and then it traverses this course and reaches the lateral surface and then reaches the tip of the tongue to supply the various branches to the tongue. So it is related inferior or deep to the hyoglossus. So first is related to the stylohyoid ligament. Second thing is related to the lingual artery. Third thing is that the first loop of the lingual artery, as it arises from the external carotid artery, is crossed by the inner. So first loop of the it crosses the nerve, touches the first loop, then runs on the superficial surface of the tongue. And supply all the muscles of the tongue except the palatoglossus. So this is the last cranial nerve, that is called the hypoglossal nerve. The third thing on the posterior border is related to the glossopharyngeal nerve. So glossopharyngeal nerve comes downward in relation to the stylopharyngeus muscle, and then it also goes deep to the hyoglossus after passing behind its posterior border. So this is the ninth nerve, the glossopharyngeal, is also related to the posterior border because it has to supply the posterior 1/3 of the tongue. So it traverses this part, it comes down with the stylopharyngeus muscle. Stylopharyngeus muscle is related to the glossopharyngeal nerve. Stylopharyngeus. Then comes the superficial surface of the hypoglossus muscle. So superficial surface of the hypoglossus muscle in its uppermost part is related to lingual nerve. As the lingual nerve leaves the tongue from its posterior lateral part, is a sensory nerve to the anterior two-thirds of the tongue, branch of the mandibular nerve, anterior division, posterior division. The lingual nerve is lies on the hypoglossus in the uppermost part, and to this lingual nerve is hanging by two roots a ganglion that is called the submandibular ganglion, and just deep to it, so low to it, there lies the, just below it, there lies the deep part of the submandibular gland. Deep part of the submandibular gland is just below the submandibular parasympathetic ganglion. And the hypoglossal nerve is the lowermost in position on the superficial relations of the hypoglossus muscle. So this is the hypoglossal nerve. We call it hypoglossal, means it goes, hypo means below the tongue, and then it runs upward to supply all muscles of the tongue except the palatoglossus muscle. Lingual nerve is sensory nerve, is going out of the tongue upward. It is accompanied by the chorda tympani fibers which comes down through the one of the root of the submandibular ganglion, through which the postganglionic parasympathetic fibers they arise, and they supply the deep part of the submandibular gland, as well as the other postganglion fibers. They go in the other root of the submandibular ganglion, and they supply the anteriorly placed sublingual gland, salivary gland. Both the glands they are supplied by the submandibular parasympathetic peripheral ganglion. So this is the final diagram showing the relations of the hypoglossus. The posterior border is related to three things: stylohyoid ligament, lingual artery, and the glossopharyngeal nerve. The superficial surface of the hypoglossus is related from above downward. Is the first is the lingual nerve, then the submandibular ganglion, and then D part of submandibular gland, and fourth part is the hypoglossal nerve. The 12th nerve is related to. Regarding the nerve supply of the muscles, all the muscles we have seen that they are supplied by the hypoglossal nerve, except the palatoglossus, which is supplied by the accessory nerve through the pharyngeal plexus of the pharynx. Regarding the applied anatomy of the tongue, as we know, the cancer of the tongue is very common, and in the cancer of the tongue, we remove the growth over the tongue, as well as we remove the half of the tongue, and this operation is called the hemiglossectomy. Hemiglossectomy. After that, we give the speech therapy to the patient to speak, and we give the food therapy also, that how to eat with the half of the tongue. So that is the C of the tongue is common because of the tobacco chewing and the cigarette smoking are the most common causes. And in other forms, we also remove the half of the tongue along with the bilateral cervical lymph nodes. They are also removed. This is called the commando's operation, or also called the block dissection of the tongue. Block dissection of the tongue in the advanced cases of the cancer. And then there are applied related to the muscles of the tongue. They are the paralysis of the muscles of the tongue because of the injury to the hypoglossal nerve. So injury to the hypoglossal nerve will lead to the paralysis of the half of the tongue muscles. Half of the muscles of the tongue, they are paralyzed, and when we ask the patient to protrude the tongue out of the mouth, the tip of the tongue, it deviates towards the paralyzed side. It is because of the unopposed action of the muscles of the tongue. The tip of the tongue is going. Third applied we have already done, that is the genioglossus. The genioglossus muscle is the safety muscle of the tongue. In the paralysis of the pharynx, pharyngeal musculature, the tongue falls back, but the small muscle keep the tongue in the, even in the paralyzed state also, in the forward direction, and it prevents the blockade of the pharynx posteriorly. So that is the function of the genioglossus muscle. That's all about the muscles of the tongue.